Hello, sir. Good evening.
Good evening.
Good evening, everyone. So we have Dr. Ajit Kulkarni, sir, renowned homeopath, mentor as well as a teacher. And sir need no introduction. And I'm very pleased to announce that sir is going to take a session, take a course, a full-fledged course on homeopathic musing on cancer management. It will be have 8 sessions, and sir will be talking something about cancer management today and will brief us what we could expect from this course. So I welcome you, sir, on the platform, and I'm very pleased and very glad that you are going to take this course. It would be one of a kind. Sir, before you have anything to say, I would have a few questions to ask you. I first want to know your experience in treating cancer patients and how have you managed cancer as a disease, and how have you managed the patients as a
Yeah,
whole?
you see that I have been practicing homeopathy in the last 36 years.
Right, sir.
And once I became an international teacher during 2003, then I got an opportunity to treat cancer cases not only from India, but from outside. That increased my understanding of the personalities, my understanding about the food, the physical environment, the mental environment, the effect of the culture, because many of the illnesses are related to the influence of the culture. It is very interesting. Although illness is a very personal experience, yet the effects that are caused by several issues, they exert their influence over us because we are dynamic. The
Right.
forces that operate upon us are also dynamic, because we are interwoven by the dynamic forces which make us cohesive. This cohesiveness is lost in cancer. The basic theme of cancer is failure of symbiosis. You see, when we are born, we are trillions of cells, but each cell during our state of the health remain healthy with the concept of the symbiosis. So it is a very marvelous, wonderful laboratory within us which operate at the level of give and take. The process where everything is happy, everyone is happy, every cell is happy. There is a good transportation. There is inhibition of the growth of the cells. There is a discipline which is followed. And if you see, cancer cells do not follow the discipline. They are not organized. Their language is just to grow, grow, and grow. Do not follow the norms. Do not follow the conventional theme of the discipline. I have to stop growing. Have you seen a liver cell growing so much that it has entered into the kidney cells? Have you find a neuron of the brain metastasizing into the kidneys during health status? No, because we know when to. The cancer cells do not have this understanding that they have to stop. And there is no DNA repair with the cancer cells. Why this occurs is a very central issue. We will try to focus in our 8 sessions. And this is a very big presentation, 2 hours each. I will talk with you for almost 16 hours. So we will cover up a lot of issues about the cancer. You know, cancer is regarded as a primitive language of one cell from which we grew. We evolved from amoeba, just one cell, and then we become multicellular. And now cancer wants you to make one cellular. Why? Why there is a regression to the primitive process? Why you want to be an ancient in the past to go for this? And what is the outcome of this? These are very pertinent questions we have to understand. So we will cover up a lot of issues. You know why cancer is increasing today in the modern life? Who is responsible for this? What about our environmental stimuli? Are we taking healthy food? Are we taking healthy air? Are we taking healthy water? Are we polluted in mind always? As a biological system, we have our mind and body as a coordinate system. But what is happening to us? Body tells something else, mind tells something else. So we are at variance with the cell. And this is exactly the language of the cancer cells. They are distant from the norms of the body. They do not follow the central rules of the growth. So these all issues we have to discuss. And each case is a big lesson for us how the development of the process of the cancer begins. Even in good people whose food is very good, their mind is very sound, they are religious and spiritual people, they also suffer from cancer. Then why? If we think that environmental stimuli is very bad, they are bad for everyone, but less bad for some people, yet they suffer from cancer. All these discussions need a big discussion platform. I'm very happy that musings have accepted that they will give me the platform to cast my opinions and illustrative cases to present the theme of development of the cancer and the management of the cancer.
Right, sir. We too are glad that you will be taking the course. I have a few questions regarding
Yeah,
cancer as a whole.
yeah.
In homeopathy, is there any specific cancer or any specific stage through which we can help in through homeopathy? Like the scope of homeopathy, is it in specific cancer? Is it good? Like, do you know of anything? Any cancer type where homeopathy has worked wonders, or any cancer stage where homeopathy has worked wonders?
You see, homeopathy doesn't go by the level of the disease. However, the advancements that occurred in the classification of the cancer and several modules which have been developed to understand the type of the cancer, the stages of the cancer. The test also shows whether the cancer is in the which grade stage. It is the first grade, second grade, third grade, fourth grade. How much metastasis has occurred on the background of the PET scan of the whole body. All these investigations give you an assessment of the forces of the disease potential. They also have a big say in the homeopathic management. If the patient is in the fourth stage, age is 90 years, you cannot cure
Right.
this case. Then can you ameliorate the suffering and will you allow the patient to die with dignity, less
Right.
pain, less suffering? This is also a big issue. We have the concept of the euthanasia in homeopathy, which is also a needed concept in medical science. So stages which have been studied must be known to a homeopath. The investigations are also needed to understand how far your remedies are acting. So all these diagnosis, assessment of the stages, as an oncologist in allopathy, modern medicine understands, the same understanding is there with homeopathy, because the concept of the disease understanding is the same in homeopathy. But we make two types of diagnosis: disease diagnosis, including the stages and the grades, and the second, person diagnosis. So these two make a comprehensive diagnosis in homeopathy. This is a very important concept. When we discuss any case in homeopathy, are we at these two levels in the operational view management of the patient? Have we understood the patient very well? Have we understand the disease very well? So this concept is a basic in all diseases with the humans who confront us in our clinical practice. The same to the cancer. So
Very
I
well
cannot say
said, sir.
that
Very
this
well
type
said.
of cancer has much more. utility part in homeopathy, but my experience suggests that cancers which are local, which have not metastasized at all,
Hmm.
maybe now they are better after surgery, better after radiotherapy, better after chemotherapy. There is no
Hmm.
recurrence. Such
Hmm.
cases respond very well in terms of the prevention. Those cases where chemo has not been given, the radiotherapy has not been given, the cancer is localized,
Hmm.
these cases respond very well to homeopathy. The earlier the treatment, it is always better. The homeopathic concept is both prevention and the treatment. The treatment part is totally dependent upon the stages. The law of similars says that it homeopathy cures the illnesses when they are in curative part. They are reversible. Even there are
Right.
three types of the disease potential. First, reversible, then borderline, and then irreversible. We have our own criteria in addition to the investigations in homeopathy, which we will discuss also. So those cases which have been defined as reversible are reversible also with homeopathy. Borderline cases may turn into irreversible or may turn into curability. That totally is dependent upon a person, the knowledge and the intelligent use of the homeopathic doses, the repetition schedule, all these along with the management of a case, including the diet and everything, will give us an assessment whether we are successful in borderline cases. Most of the cases which are irreversible, I'm very clear that they cannot be cured with homeopathy. But the amelioration can be given with homeopathy because sometimes the cases are given, you see painkillers for a very long time. Sometimes the bleeding is continued in open cancers. You see the discharge, which is very offensive, is continued for a very long time. And then the patient is exhausted of the treatment, of chemotherapy, of antibiotics. In such cases, I have found homeopathy very useful. The wounds get clear, the discharge gets clear, and I will present a number of illustrative cases to fortify my points where homeopathy really helps. Because cases are the best testimonials for a homeopath to understand whether we are giving the relief to what extent. Yeah.
Right, sir. So you mean to say that even in palliative care, homeopathy can help the patient a lot. So
Yes.
also regarding the remedy, you said we need to understand the patient as a whole as well as the disease. So is it in cancer that you should be treating the patient with a specific disease regarding a specific organ, or is it that you can give similar and expect it to work and expect the cancer to be managed with a similar or does a specific remedy needs to be given? What is your opinion regarding the same?
Uh, I am not in favor of giving the specifics
Hmm.
cases like cancer. Although I can use organotrophic remedies and mother tinctures, I also use biochemical remedies in the management of oncological cases. However, I am in favor of giving value to the totality
Right.
because totality is the real guide in homeopathy. Candurongo is a great remedy for esophageal cancer. Therefore, I will not give. I will study Candurongo from the Mater America. I may give a constitutional remedy along with Candurongo in mother tincture or in low potency if needed. But as a homeopath, where I have been practicing since many, many years with oncology also, I will say that the constitutional approach plus organotrophic approach helps a lot. It is not just that you give the constitutional remedy. I have found that the cases respond when you are giving biochemical remedies also, when you are giving organotrophic remedies also, when you give sarcores also, when you give mother tinctures also. So you have to be at many levels in cancer cases. This is basically because cancer causes n number of metabolic changes, n number of biochemical changes in the body. And these changes are progressive if untreated, and therefore they present a lot of symptomatology during the process of the treatment. So naturally, you are required to be very alert to treat them whenever they will come up. So this is a very important aspect, that whenever a case comes to you of a cancer, sometimes it may present to you with some acute. And then that acute must be treated because it could be severe and it could be life-threatening. For example, I have a case of leukemia where the patient started having bleeding. He was hospitalized and he was about to now die because nothing was helping. And Crotalus horridus, which was given in 1 potency every half an hour, stopped the bleeding. Okay, he died afterwards, but the way in which Crotalus really helped the patient was a big, remarkable success of homeopathy. So, constitutional remedy doesn't mean that you have not to give an acute remedy. An acute expression comes because of a separate, different energy pattern which the system exhibits in its own manifestative totality. So we have to respect this separate, different sector totality, which could be dangerous if untreated. Acute and chronic are the languages of the system, but it presents to you. It presents to you in different ways. So you have to respect them. Law of similars doesn't mean that you have to treat only with constitutional remedy. Hahnemann also advised Rastox and Bryonia in alternation. Tyler also advised Spongia and Heparin in Krupi cough in alternation. So we have n number of cases where you will find our predecessor use some solutions. So we have to understand this whole process. And if a complex hydra-headed disease like cancer is there, its manifestations are ample and they are being manifested in such a variable way. So we have to make up several sector totalities to deal with them.
Right. So, sir, totality should be given priority over anything else, right?
Yeah.
Sir, I
Then
have.
there is one more concept. When you define the totality, you have to also define what is the essence of the totality.
Hmm.
Totality doesn't mean only conglomeration of the quantity of symptoms. There is an essence, there is a soul, there is a heart, there is a kernel, and that could be the foundation of the cancer. So in my presentation, I have also presented cancer which is based on conscience, cancer based on disappointments in life, concept of humiliation in the life. A wife is humiliated by the husband over years, and this is the very basis of the mental state. And then she develops the cancer. So, the inseparability of the components of the data must have the very basis of the humiliation. So, constitutional remedy then must be found out on this humiliation. You cannot separate humiliation from the oncological tumor which the patient has. Tumor is just an expression of the disease potential, which may come from biology, which can come from the mind also. This concept of inseparability of the constituents and the cause and effect as a phenomenon are central to understanding the oncological process, rather any disease process.
Right, sir.
Yeah,
Sir, also, I've seen many of a patient who
yeah,
are suffering not just with the disease, cancer, but also with the side effects of radiation and chemotherapy and all that sort. So,
yeah,
what is your perspective on these side effects? Do homeopathy help in these side
yeah,
effects?
yeah,
Is there
yeah.
any scope of homeopathy in such side
Yes,
effects?
yes, yes. in my presentation, there may be 1 or 2 sessions on treatment which has been meted out to the patient in terms of corticotherapy, radiation, surgery, and chemotherapy can be dealt with effectively with homeopathy. I was confronted with just a case I will illustrate. I was confronted with a case. The patient took the chemotherapy and she developed a cardiotoxic reaction. And she had almost failure of the heart with bradycardia. One of my students' relative, I personally visited the hospital and found that she has hardly 32 pulse rate per minute. I immediately began with digitalis every 5 minutes in 30 potency. And gradually, her pulse rate ascended to almost 60 per minute. So acute cardiotoxicity was being treated with digitalis. And I always say that one of the best bridge, one of the best bridges to connect oncologist allopathic with homeopathy is the field of chemotherapy-induced symptoms, how they can be mitigated with homeopathy. We have a very wonderful remedy, uranium nitricum, which was presented very nicely by Sujit Chatterjee.
Right, sir.
You see now how this very sincere homeopath gave us a very unique characters of the life and death issues of uranium nitricum. I have been using uranium nitricum since almost more than 15 years over chemotherapy-induced side effects. So we have really a very big armory to deal with the effects of the chemotherapy. And I have ample experiences with them. I treated recently a case of chemotherapy-induced side effects, persistent vomiting with debility, with chininum arsenicosum. A very remarkable result within 2 days. It means that this is a field. If an oncologist in a hospital works with homeopath, then it will be a very different picture now. At least I say, let us begin with this bridge. Let us connect with the side effects of them. And then let us then enter into the homeopathic aspects. How
I
we can.
hope that happens, sir. That will be a phenomenal change in both
Yeah,
the system,
yeah,
both the medical system. I
yeah,
hope that
yeah,
happens one day.
yeah.
Sir, I have got some brief idea. I just want you to tell what all uh, participants can expect from this course, from
You
cancer
see,
management.
yeah. You see, first we have to understand what is cancer. And we have to understand this. Each cancer is unique in a unique patient. This is individualization, which is the very foundation of homeopathic practice. How we can understand an individual with a cancer with cause-effect relationship. Then I will be giving you many ideas that have come from the research in biology, research in physiology, research in anatomy, in pathology, in alternative systems also. How Ayurveda approaches cancer, how a homeopath approaches cancer. All these ideas about cancer we will be presented through our lectures. So you will have a wide panorama. I want to say that, for example, let us study. I want to select a remedy suppress anger as a rubric in a patient. And now I do not know what is anger as an emotion. I select a rubric, maybe I am able to treat the patient well. But should I know what is anger or not? You see now, anger, as has been studied in psychology and psychiatry, is a very big theme. Now, very important aspect is that if you know what is anger as an emotion, then you are in a better position to select a rubric, a better rubric, a fitting rubric. So in a way, study of the emotions is basic to understand the mind rubrics, study of cancer is basic to understand the field of homeopathy. This is the reason why I have taken up this issue, that our students should not lag behind in understanding what is cancer. So much research, research in cancer is so much that our life will be spent in reading out the research papers. They must be integrated with homeopathy. You at one level will say that homeopathy is holistic. You do not want to look at the integration, which could give a big theme, big push to homeopathy to understand the real holism of homeopathy in oncological cases. So the purpose of all of our presentation is to become broad, to make our vision broader and operational in terms of the management according to the stages. In my presentation, there will be a big presentation on miasmatic assessment of oncological cases. This is also very important. Which you see cancer is psychotic, which cancer is tubercular, which cancer is syphilitic. Can cancer be suric? Is it possible? This is a discussion, logical discussion, which we will make. I will talk with you. I will allow you to interact with me. It is not that just I will talk in a dry way and you have to just listen to me. I am with you because I want to teach you in an interactive group discussion way. And this is the best way to understand the practical side of homeopathy. So I will be with you in every lecture with some illustrative cases, which will give you an assessment how homeopathy really works. What was the totality? The repertorization is before you. What is the filter which repertorization give you? Why? On the screen, you have a lot of remedies, and I want to select a remedy which is fitting to the case. And what is the result of this? So I will try to be with you, and I will try to see that your vision in the treatment of the cancer cases becomes more broad. And you are in a position to understand, yes, what I have to do now. It is not just listing of the symptoms and you treat on the background of the symptoms alone. Behind the symptoms, there is the biological system. There is the miasm. There is a disease potential, and there is a person with his mind, with his soul, with his life. So we will cover up all these issues through integration. And cancer is never a local disease. It is a systemic disease, may be expressing locally.
Sir, I'm personally, after all this, looking forward to this course. And I'm sure we'll have a lot to take back from this course. I'm sure a lot of people who have heard you right now have got a small glimpse of what the course would be all about. So I would really expect people to join and register for this course. And our early bird is going to end very soon, in a day or two, on the 15th of March. So do register for the course. And thank you so much, sir, for taking out time and just sharing a few glimpses of the course with us. Thank you so much. And
Yes,
I'm really looking forward to having
yes.
this course with you on our
And
platform.
I appeal the homeopaths from India and outside that attend this course. Let us have a new angle of understanding the homeopathy with the holism of homeopathy, the rational scientific therapeutics of homeopathy, await the application in oncological cases for the suffering humanity all over the world.
Right, sir. Thank you so much, sir.
Okay? Yes.
Thank you.